Scoliosis is a descriptive term rather than a specific diagnosis, and in many cases the specific cause of a spine curvature is not known. In this case, we term the scoliosis idiopathic. This is particularly true of the type of scoliosis that develops in adolescence, which is why we call it adolescent idiopathic scoliosis. Significant ongoing research continues in the field at this point, but as of today we do not know a specific cause for adolescent idiopathic scoliosis. On an X-ray, the spine of a person with a scoliosis might appear as a C or as an S shape rather than a straight line. We do have accurate methods for predicting curve progression and good methods of treatment. Approximately 30% of patients with adolescent idiopathic scoliosis have a family history of scoliosis, so we do feel that there is a strong genetic factor. Current research is trying to identify the genes that can cause scoliosis. This knowledge would be very important as we could diagnose scoliosis at an earlier age and predict who's at risk for progression of their scoliosis. Treatment options from scoliosis fall into three main categories: observation of the scoliosis, non-operative treatment, and surgical treatment. Observation of scoliosis is best used for small curves in growing children or for moderate-sized curves up to approximately 45 degrees in patients who have finished their growth. The purpose of brace treatment is to prevent progression of a scoliosis curve during a period of rapid skeletal growth. Brace treatment cannot correct an already present scoliosis. Surgical treatment is generally reserved for the treatment of scoliosis over approximately 50 degrees in adolescents and in adults. Surgical correction can be used for scoliosis curves that are smaller if the patients are particularly bothered by their curves or if they have symptoms from their curves. Surgical treatment generally consists of placing metal implants on the spine which correct the rotation of the spine and prevent progression of the scoliosis curve. For patients who are being observed by their physician for scoliosis, they are able to participate in full activities without restrictions or risk of injury. For patients who are undergoing brace treatment for scoliosis, they are able to perform all their normal activities during the periods of the day that the brace is not being worn. For patients who undergo surgical treatment of scoliosis, activity modification is needed during the time that the spine is healing, with the end goal being that the patient will return to full activities once the spine fusion has occurred. We see a number of children with scoliosis here at Virginia Spine Institute, and the majority of patients we're able to treat without having to do surgery. Observation of scoliosis does require a number of visits to the physician, and we develop a very close relationship during that time, but I take pride in all the patients that I'm able to treat without surgery. When surgical intervention is required, I use the most advanced current techniques to perform spinal deformity reconstructive procedures to give the patient the best cosmetic and clinical outcome with the least risk.